Hi, I'm Erin. I'm the owner of The Educated Nurse, and today we're going to talk about test taking strategies. So, whether you're an EMT or a paramedic student or a nursing student, I'm going to give you some strategies to help you analyze questions that you would find on your exam and then give you some strategies on how to sift through answers so you can pick the best answer on your next test. If you're new to us, you can follow us on Facebook and Instagram, and then now our YouTube channel. And then we also have a shop on Etsy where we sell study guides, templates, and merch too. So check us out. All right, let's dive into some test taking strategies. Okay, first up, test taking strategies. The foundation of any question is really going to be based on Bloom's taxonomy. In your entry level classes, whether it be paramedic or nursing or whatever, it's going to be more foundational type questions, entry level questions, where you're really just going to be remembering and recalling and understanding the information. As you progress through your schooling, especially in the nursing program, you're going to find that a lot of the questions are based on more of application and analyzing of information. So you have to use critical thinking and some nursing judgment to help you answer those questions. It's no longer just going to be a basic question about, what type of medication is metoprolol? Well, we know it's a cardiac medication. Advanced level nursing questions, you're going to have to answer them and use that base knowledge to know that it's a cardiac medication, but maybe you need to provide some patient teaching, or maybe you need to know what side effects you would want to educate your patient about. So it's knowing base information and then using that information to take the question the next step further. When answering questions, it's really important that you use your clinical judgment. You don't want to bring in personal experiences or anything like that. And remember, the NCLEX is going to test you in a box. So you have to just think of NCLEX world or testing world or school world, wherever you are. Don't bring in outside experiences or personal experiences because it may or may not be right and you don't want to answer that way. So it's important to use clinical judgment and the strategies that you've learned in school to help you answer the questions. So step one, really we want to look at dissecting the parts of the question. So when we do that, we really have to just ask ourselves, what is the topic? What is the question really asking us, right? So we're going to look at how to break down a question here in just a moment. Step two, you have to ask yourself, what is the question asking, but what's the answers am I supposed to give? Are they asking about assessment in the question? Because if they are, then I should pick an assessment answer. I wouldn't want to pick an action or an implementation answer if they're looking for assessment. Step three, we always want to prioritize. A lot of these questions will have answers that are probably all right, but then how do we pick the best one? Prioritization is key, and I'm going to give you some key examples on words to look for or key phrases that might clue you in that that's a priority patient. And then step four, if it's asking you about evaluation, when you evaluate something, are you evaluating the interventions? Are you evaluating an assessment? So again, looking at what is the question really asking me, and am I answering it in the way that it's asking me? Okay, so making sure that the question and our answers are aligning. So let's dive into that a little bit more and breaking down the question. All right, let's break down and dissect our question. So there's three parts to the question primarily. You've got the stem, which is like the general information in this scenario about your patient. You've got distractors that may or may not be relevant to the scenario or to what the question is really asking, and it might not be relevant to your answers. So you've got distractor information, which for the most part you can eliminate. And then you have your options, which is another word for saying answers. So let's look at this question. 45-year-old African American male comes to the ER with substernal chest pain. He rates it 10 out of 10. As an ER nurse, I would say, ding, 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 red flag. That could be a heart attack. I would kind of be worried about this patient. All right, so that's like your main stem of the question. There is a follow-up part of the stem that's equally as important, which is what the question's really asking. So we're going to get into that in just a second. Some distracting information, as you can see in the question, is the patient was playing basketball 30 minutes ago and he tripped over a shoelace. Not really relevant. He has a history of asthma and gallbladder disease. may or may not be relevant. We'll think about it, but probably not something that's going to help us right in this moment. There are times when past medical history is important, but I'll show you in a little bit here, and we're going to talk about why it's not important here. And then it gives the patient's vital signs. Okay. So vital signs, you're thinking to yourself, well, yeah, Aaron, that's important. We need to know the patient's vital signs. It's a distractor in this question, and we're going to talk about why it's a distractor later. Okay. So then the other main part of the STEM that's super important is, what diagnostic do you expect the doctor to order based on the patient's presentation? This is why the vital signs and the patient's history is not relevant in this question. The patient is coming in with 10 out of 10 sternal chest pain or substernal chest pain, which started probably within the last 30 minutes. He's got shortness of breath and nausea, and is asking what diagnostic test is going to help us get information now about this patient. So then you're going to have to look at the answers or the options and figure out which test is appropriate. And we're going to talk about how we can weed through those in just a second. Okay, there are four main types of stems. There's the complete sentence stem, which gives you all the information in the item itself. The question that we just looked at is a complete stem. It gives us all the information, and that's usually positive in nature. There's the incomplete stem, where it gives you some information in this stem, but then the answer helps make it complete. You have a positive stem, which is what most questions are. The stem is going to be positive, and the option and answer will be positive also. And then there are negative stems, which asks you false or incorrect information. So if you were to have a patient education question, for example, and they say, based upon the information that, if you're doing a teach back and it says, based upon the information that your patient is telling you, what tells you that the patient doesn't understand information? Or maybe you have to list off all the side effects of Lasix. What information is incorrect? So you'd want to pick the one that's not correct, or the negative answer. So looking at the different types of stems, you can kind of guess what answer, or not guess, you'll know which answer you can pick based upon the type of stem it is. Okay, so here's some examples of positive versus negative stems, and then maybe some question examples that you would see it in. So for a positive stem, you want to look for those positive strategic words. So all, every, always, those kinds of things. Your negative would be never, accept, incorrect. And then you can see on the right side is just some examples of how to use those positive and negative keywords. So again, if you're looking for a positive stem, you want to try and find a positive answer, and vice versa with the negative stem and negative answer. Okay, here are just some general question reading tips that I share with my students all the time. Read the whole question. Don't skim. I don't know how many times I have had students that have said, oh, I missed that. Especially when it says, all of these answers are correct except, and the students miss it. And then they pick a positive answer when it's really a negative question. Not helpful. Read the whole question, don't skim. This is also important if you are going along and you're like reading through the stem and you're like, oh, I already know the answer. And then you miss some key information, or you are guessing what the answer is going to be based upon, the beginning part of the question, but then you miss a key sentence, or you miss it where it says pick an intervention and now you've picked an assessment. So read the whole question, please, pretty please. Don't skim. I promise you it will help you so you don't miss easy ones, okay? 2, determine the nature of the question. Again, is it asking for assessment? Pick an assessment answer. Is it asking for an intervention? Pick an action, right? Who's the patient? Maybe you've got a question where you are caring for their patient and their wife, and you're providing discharge education. Who's the patient? What do you really need to focus on? Are you focusing on the caregiver, or are you focusing on the patient? Figure out who the patient is. Again, asking the question, what is it doing? Are you assessing, intervening, diagnosing, evaluating, and making sure you're picking the appropriate answer? Look for your adjectives and your action words. What are you going to do first? What are you going to do next? Right? Is this an assessment? Is it an intervention? Look for, is it positive or negative? Are you looking for an evaluation? Do you have to already see what's been done and now you have to determine if it was correct or not? Figure out what the question is asking. And if it's picking an action and is asking for an action, pick an action in your answer. If the question asks for an assessment, don't pick an intervention. I think you're going to figure this out sooner rather than later. Make sure you're looking for what it's asking for and you pick the appropriate answer. Okay, so we just talked about some strategic words. What are you going to do first, or what action is best? Priority or prioritization. What answer is most correct, right? Because we can certainly have questions where all the answers are correct. So making sure you are looking for those priority keywords. I know that was one thing that we had switched to at my last teaching job, where we were highlighting, circle star highlighting those priority keywords so students wouldn't miss them. Students still missed them anyways. So make sure you're reading the whole question and looking for those priority strategic words. And then you can kind of see too on the right hand side of this slide, just some ideas and examples about things that would be a priority that you would want to look for. So when we're looking at priority assessments in patients, this screen kind of shows you some priority patients that we want to see first. Like if you're given the option of 4 different patients, at change of shift and you have to determine who's the sickest or who you want to see first, some of these keywords will help you figure that out. First and foremost, ABCs. Anyone who has trouble with their ABCs, airway, breathing, circulation, you should be checking those patients first. And I'll give you some tips about keywords to look for ABCs in just a minute. Neuro would be next, right? I always share with my students the first stop on the oxygen train is the brain. So if someone's having trouble with any neurological system problem or they're having neuro signs and symptoms, we would want to assess them next. Then we start to look at GI/GU, musculoskeletal, skin, and then psychosocial's last based on Maslow's, right? So we always deal with the physical before the mental health. Now, I will say in some situations, mental health can be a higher priority. Like if you have a patient who's actively suicidal, that kind of safety risk would certainly make them someone that we would want to see first and a higher priority. But we always typically look at the physical symptoms before the mental health. So then the other thing you want to think about with prioritizing patients, anything again with ABCs, you're going to find a theme here, right? ABCs. The other thing you want to think about when you're looking at the question and the answers, are you seeing answers that are an expected finding of the disease process, right? So someone with heart failure might have edema. Are we going to get wacky about it? Probably not, right? It's an expected finding. Now, if we have someone who's having 10 out of 10 chest pain, they've never had this chest pain before, the pain radiates to their jaw, that's not an expected finding. It might be for a heart attack, but that's not expected for that patient. The patient has no history. We don't know that they have any issues with that. So an acute problem is something that we want to address over a chronic problem. So an acute problem would be sudden onset 10 out of 10 chest pain versus a chronic problem of maybe a type 2 diabetic has a blood sugar of 230. Yeah, that's abnormal, but that's an expected finding for that diabetic patient. And it's really probably not going to kill them to have a blood sugar of 230. 10 out of 10 chest pain with an acute coronary syndrome could potentially be something that could be very serious. So what's expected for that disease process, what's unexpected, and then a real problem versus a potential problem. So a patient who is a risk for falls is probably not someone who has current 10 out of 10 chest pain, right? So just kind of think about those things too. When you're looking at the question, they have all these chronic diseases, what's expected versus unexpected, what is new versus chronic, and then what's a real problem versus a potential problem. And then like I always say, go back to those ABCs. If something's wrong with their ABCs, that needs to be addressed ASAP. Okay, keywords for ABCs. So keywords for ABCs, let's start with A, airway. So patients that don't have a patent airway, your patient isn't ventilating, vital signs are abnormal, right? We need an airway to survive. So anything that could obstruct the airway, if a patient's having an anaphylactic reaction, if they have a foreign body, if their respiratory rate is abnormal, or they're showing signs that they're struggling with ventilation, that's a problem too. If they are NPO, if they don't have a gag reflex, um, if they have dysphagia or anything regarding their airway, airway is first. Breathing, right? Just equally as important. If your patient can't breathe, they're not going to live very long. So keywords for that would be breath sounds, O2 sats. If the patient's getting oxygen, that might key you in that something is abnormal. Their pulse ox rate, their maybe their respiratory rate is elevated. Maybe they need to use incentive spirometry. Maybe something is going on with their breathing. Okay. Circulation, no, circulation is not good, right? So circulation keywords could be heart rate, blood pressure, pulse, fluid status. Are they deficit in fluids, or are they fluid volume overloaded? What their pulses might say. Are they getting IV fluids because they might be dehydrated? Do they have a central line? Are they bleeding? Those kinds of things would tip you off that ABCs could be a problem. And then safety is in here too, and we kind of talked on the last slide here about what is a real safety problem versus a potential safety problem. So dealing with physical needs first and then psychosocial is important. But like I said, there could be certain situations where your patient safety could be a priority that you would have to address. Like I said, that suicidal patient. Okay? Let's look at the answers now. Okay, when we're looking at our options or our answers, we want to look at prioritization. So you're going to see a lot of these questions in your advanced exam questions. So you want to look for some keywords. Which patient is a priority? So if you're coming on shift and you have to see 4 patients after you get report, which one is the priority? Which one is the sickest? Some things that might clue you into a priority patient: your patient presents by ambulance, or your patient's going to the emergency room versus maybe a patient who's in long-term care, right? Because they have more chronic disease. Someone that comes into the emergency room, hopefully, because I'm an ER nurse, right? Not everybody comes in an emergency, but most patients that come into the emergency room are having an emergency. Okay, so those would be a priority patient versus someone who's maybe in the primary clinic or they're in the long-term care setting. Okay, so those would be a priority patient. Someone who comes in by ambulance, again, hopefully they're calling 911 for the right reasons, but they would be someone that would be like, maybe I should check on them first. A patient returning to the floor. So say you've got a patient that's on the cardiac floor and they're coming back from the cath lab after they've had a heart attack and some stents placed. Ooh, they would potentially be unstable. One for arrhythmias or just from sedation. I'd want to see them first. Or a patient coming back from surgery. Again, they have the potential to be unstable, so I'd want to prioritize and see them. When you're looking at interventions, again, all the answers might be appropriate, but which intervention is the most important? You'd want to pick that one. And then again, which one would you want to see first? If you kind of get your spidey sense as a nurse, right? Sometimes, like, you're going to see all these patients. Is there something abnormal with this particular patient that raises a red flag that you'd want to see first? But just back it up with your clinical judgment. All right. All right, so here are some other tips for when you're picking your options or your answers. Eliminate comparable or alike options. They're probably both wrong, right? So if your patient's asking you about, or your question is asking you about fluid volume deficit, and you've got answers that are clearly signs of fluid volume overload, well, you could probably eliminate those, and now you're down to a 50-50 one. So eliminate alike or comparable options where you're comparing and contrasting. The umbrella option is used a lot. So the umbrella option is an answer that encompasses everything, all the other answers. So an example of that could be like, you're having a mass casualty at your hospital and the nurse has to decide what she's going to do first. Is she going to call for help or call in extra staff? Is she going to clean up the unit, maybe discharge some patients? Is she going to call the nursing supervisor to enact the mass casualty incident plan? So the umbrella answer there would be call that nursing supervisor to enact that mass casualty incident plan, because enacting that plan is going to help deal with all the other answers that are in the question. Closed-ended words are likely incorrect. So when you see questions that have answers that say all patients, well, we know that things don't apply to every single patient. Or you see things like never. Your patient can never go outside again. Like if they have lupus and they can't be out in the sun, they can never go outside. Well, eliminate that because that's not true, right? We just throw some sunscreen on. Okay, so eliminate all, never, none, those kinds of questions or answers. When you're looking for a communication question and they want you to pick a therapeutic answer, you want to pick something where you're actively listening to the patient, or you're asking the question to tell you more, or asking the patient to tell you more about the condition. You don't want to find any answers that are dismissive, right? So a lot of times you're going to be listening and actively investigating how the patient feels about something. You don't want to just say, well, you need to decide that on your own. That's kind of a dismissive answer. So picking a therapeutic question really looks at communication and exploring how your patient feels about something, and making sure that you're picking a positive therapeutic communication technique and not something that's closed-ended or really standoffish or dismissive. When you're finding a delegation question on your exam, you have to know what you can delegate. Okay, what can the nurse do? What can the CNA do? What can the doctor do? What's something that a non-medical person could do to help with your patient care? So making sure that you're delegating appropriately is super important. And then making sure if you do delegate that the nurse is coming back and following up on that. And then if you have a medication question, you just want to follow like current evidence-based pharmacological recommendations. We talked a little bit about delegation on the last slide. You can kind of follow along with this slide and just review what the nurse can do, what the LPN can do, what the CNA can do, and then just some tips for delegation on the bottom. And just to kind of remind you what's appropriate to delegate and what isn't. So when you're picking those delegation answers, you're following kind of the rules of the workplace and the NCLEX. Finally, let's really dissect that question a little bit. So we talked about the STEM, we talked about distracting information, and then we talked about the options and the answers. So remembering back, this was this 45-year-old African-American male patient who was coming into the ER with that substernal 10 out of 10 chest pain, complains of shortness of breath and nausea. To me, I'm thinking heart attack, right? Or some sort of acute coronary problem. Again, the distractor here is that the patient was playing basketball and he has a history of asthma and gallbladder disease. Like, that's nice, but it's not super important, right? The vital signs, when we look at the vital signs, they look normal. Yeah, he's a little tachycardic and tachypnic, but none of his other vital signs are anything that I would get as an ER nurse, I would get really worried about. We usually say, like, unless their blood pressure is really high or really low, it's kind of okay, right? And this patient's in pain, so we would expect a little bit elevated blood pressure. We would expect that they'd be a little tachypnic and tachycardic, right? So again, going back to those expected versus non-expected findings, I would expect a person in 10 out of 10 pain to have a little bit of elevation in their vital signs. So I would consider this patient to be pretty much vitally stable and not really something I'm going to worry about. So yeah, I mean, you could easily get distracted with, oh my gosh, this person's pulse is 110. That's abnormal, Aaron. It is abnormal, but it's not something we're going to worry about. Then the question is really getting to what diagnostic test will you expect the doctor to order based on his presenting scenario? He's coming in with 10 out of 10 sternal chest pain that just started within the last 30 minutes, and we're thinking acute coronary syndrome. I would expect the doc to order an IV, labs, and an EKG, and that EKG better be done within 5 minutes, right? We got to see if this person's having a heart attack, right? So when you look at the answers, putting on a 4 liter per minute nasal cannula, that's not a diagnostic test. So it's looking for a diagnostic test. We can automatically eliminate that one, right? But you could be saying, well, Aaron, didn't we just talk about ABCs? We did, but that's an intervention and it's asking for a diagnostic. So we're going to eliminate that one. Ding, ding. Number 2 is our EKG. We want that diagnostic test. That's going to tell us right now if our patient's having a heart attack. So we got to look at that, right? A CT or the chest and abdomen, it's not really going to tell us anything right now, right? And then outpatient cardiac stress test. Well, the patient came into our ER, so we might as well help him feel better while he's here. I agree that maybe setting up an outpatient cardiac stress test is a good idea, but it's not going to give us any information right now while the patient's in the ER with us. Okay, so that's just some ways that you can weed through and dissect a question. All right, so thanks for watching our quick video on test taking strategies. This really just scratches the surface, you guys, on how to answer test questions. If you thought this was helpful, but you're needing some more help, we actually have a study guide on this. It's called Test Taking Strategies and Test Taking Tips. It's in our store, so check it out on Etsy and Shopify. If you want to connect with us, follow us on Facebook, in our YouTube channel. You can like and subscribe, and on Instagram, where we're going to be putting more quick videos together and really start breaking down all the different body systems. If you have any questions, don't feel free to reach out. Don't hesitate at all. I'm happy to answer questions if you have anything along the way. Thank you for joining us on this little quick video presentation, and we'll catch you next time. Bye.